So let's talk about your cancer journey a little bit more, because after the diagnosis usually comes the offer of treatment. Now, usually when treatment's offered, either chemotherapy or radiotherapy or surgery, of course, those three big things, people don't necessarily know entirely what to expect.
No.
What can you reflect on, having gone through your treatments? What did you have first of all?
I had the chemo first of all. Absolutely loathed it. Never have it again. I've told them that. They'd have to find me some different, alternative medicine, because there are out there, they just don't tell you.
What went wrong for you in the chemotherapy?
Well, there was lots of things. One, I felt like I was a piece of meat on a conveyor belt. There was no rapport with any nurses. They didn't put you at ease. They didn't tell you what was going to happen until after it happened. They were too late with their information. It had already happened by the time they told me. And I couldn't have anyone sit next to me, so you're apprehensive as it is. And it was just awful. And the second lot, because I had FEC-T, the red stuff wasn't too bad apart from being sick, but the steroids soon sorted that out. But the Tocidaxil stuff, that put me in a wheelchair. It took me off my legs.
Was it too strong for you?
Well, in the end, they told me I was allergic to it, so I shouldn't have had it in the first place.
There were some specific side effects which didn't...
Well, yeah, it just stopped my legs from completely working, and I got diarrhea, and I couldn't even get to the diarrhea toilet for it. It was awful.
You had diarrhea and a neuropathy, I think. Let's go back to your treatment. So
Yeah.
you managed to go through the chemotherapy.
Yeah.
It was really difficult. I take that on board.
Yeah.
What was the next treatment that you
A
had?
mastectomy, which I really didn't want. I didn't want that at all. I was hoping that the lump had shrunk enough to
You're
just
hoping
take
for
the
a
lump.
lumpectomy where they just take the local area
Yeah, but
out.
they didn't. They took the whole breast. And I cancelled it one time round because I just couldn't deal with it.
Really? What was... I mean, that's a big thing to cancel an operation like that.
No, I just wasn't ready. I mean, my partner weren't talking at the time, and all he did was ring my mum, and all I did was shove my mum away, and it was him I wanted at the time, but he didn't get that, so... Yeah, so I wasn't in a good frame of mind to even deal with it.
So you, on your side, you cancelled it?
Yeah.
And you did go back for it eventually?
Yeah.
How long was that gap?
Well, I should have gone in February, but I went in March.
Yeah.
It wasn't too long ago, because like Dr. Secure said, the longer you leave it, the worse it is. So it was a case of do it or not.
But it's interesting that you did take that initiative to delay it.
Well, I knew I had to do it,
Yeah.
but it was just being in the right frame of mind. Once we sorted everything out, it was not a problem. Then once I'd had it, I'd come out through it, and it was fine.
Now, did they offer you any options during the surgery?
What do you mean?
Reconstruction or...?
No, not at the time because of radiotherapy, because it ruins the skin, doesn't it? If you don't have radio, you can have it there and then, but I didn't know that at the time. I just know they didn't offer it me, and people come out saying, well, I've had mine already. I'm thinking, why? But it's because of the radio.
How satisfied were you with the result of the surgery?
Very. She's done a brilliant job.
Yeah.
Very neat.
So you didn't have any qualms after the surgery?
No, I was fine after that.
Yeah.
Apart
And
from a
looking
bit
back
of lymphoma, but I didn't get that. I was very fortunate. Yeah,
Lymphedema, yeah.
I didn't get that.
Going back to this question about the surgery, so I know you were really nervous about it, you delayed it, but looking back on it, would you say, given how well it went, do you think you would have gone through it perhaps easier if you knew what it was coming up? Was it one of these things where it actually was easier if you'd have known it rather than more difficult?
No, it wasn't that. It was just me and my partner at the time. We were just going for a difficult patch.
Okay.
I think it was that more than anything else.
Yeah.
And just being in the right frame of mind to deal with it.
Yeah.
If you'd gone in bad in the wrong frame, you would have come out with the wrong frame. And I needed to go in with the right frame to come out with the right frame, and that worked, so...
You had radiotherapy, I think, after the
that
surgery.
Yeah.
How long did the radiotherapy go on for you?
25 sessions.
Over how many weeks, roughly?
I think it was 5.
Yeah.
So it was every 5 days. Well, it was every week, wasn't
Quite
it? For
intense
5
in
weeks.
a way.
It is, yeah. Yeah, but it was a walk in the park compared to the other two.
I was just about to say that.
Yeah.
Compared to the chemotherapy and the surgery.
It was a walk in the park. And at least every day they asked you how you were feeling. You never got that on the chemo at all.
So you found the radiotherapy treatment radiographers more
much more
involved.
pleasant and more hands-on, and kind of understood, really.
That's good.
Yeah.
Because they've got a busy job as well, haven't they?
Yeah. And again, with the wards on 23A, I mean, the nurses and stuff, they've all been through it, and they were fantastic for getting you out of the hospital.